Hi, my name is Dr. Tarveen Alawali, and today we're at the Body Worlds exhibit at the TELUS World of Science in Edmonton, Alberta. We've been given exclusive access to use the plastinate models, like the one right behind me, to shoot our videos today. We're going to talk about low back pain. So what is that exactly, and where does it come from? All too often, some of the common causes of low back pain include lifting heavy objects, repetitive strain, or constantly being in a similar motion over and over and over again, day in, day out. You have people that have certain risk factors that put them at more susceptibility to develop back problems, such as those that are overweight, smokers, people that are over 30, and even pregnant women. They can also be at risk of low back problems.
Hello, I'm Dr. Brian Abelson. I'm just going to go over a bit of anatomy on the plastinate and a little bit of biomechanics. In terms of anatomy, we have to realize that we're dealing with back pain. We're dealing with multiple layers of tissue, about 6 layers of tissue. If we go to some of the deeper areas, we're going to run into muscles called the transversus spinalis. The transversus spinalis basically gives you the ability to flex to the side, lateral flex, and a bit of rotation in there. Go up a few layers here, we're going to run into muscles called the erector spinae. Groups of muscles which help you to lean back. Essentially, we've got the largest group of muscles along the side here called the iliocostalis, then we start getting the longissimus and spinalis muscles here. Very, very important muscles, common ones that are involved in back pain. If we start working our way down the back here and get into the hip, we can see where they've removed the gluteal muscles here. Basically, we have the gluteus medius here, and the gluteus medius is a very important muscle in terms of helping you to maintain a standing position. You can really see when people are walking along and one side of their hip starts to drop to one side, that's because they've got a real weak muscle here. But if we look underneath there, we start to see this whole section down here. This is the sciatic nerve, very large nerve. When you start getting pain shooting down your legs, quite often people will be suffering from an entrapment syndrome. The deep muscles here in the hip, and as we remove the gluteal muscles, we're actually going to get 6 muscles here. Sometimes people know about what they call piriformis syndrome. But we have other muscles underneath here. Superior inferior glomellae obturator, besides the piriformis, something called the quadratus femoris. We will start to get the sciatic nerve entrapped in these muscles here. The problem is that some people have sciatic nerves that go underneath some of these muscles. Other people wind through them. And for some unfortunate people, literally the sciatic nerve goes right through the middle of them. So every time they sit down, they entrap that nerve. Very bad situation.
So right here we can see where they've taken away the gluteal muscles and they've exposed what we refer to as the deep 6 or the deep external hip rotators. And if we zoom right in here, right in the center here, we're going to see the sciatic nerve, and it looks like that wide area in the middle there. You can just see the nerve. The nerve is quite large, actually, about as large as your thumb. And just on top of that nerve, we have the muscle called the piriformis muscle. And we also have some of the other deep external hip rotating muscles here, the obturators and the glomellae. What's also really interesting, if we follow that sciatic nerve down the leg here, I'll just fan out here a little bit, and you can see where the back of the knee is here. And then I'm going to zoom back in towards the knee here. We'll see how that sciatic nerve actually goes right between some muscle groups here. They've basically dissected away the top of the lower part of the calf muscle there, and you just see the top part. And you can see where the nerve goes through there just behind the knee. A very, very common site of entrapment where people will experience some compression.
What we're going to show here on this particular plastinate is some of the more superficial structures. Now, we looked at some of the deeper structures here and realized that we had 6 layers of tissue. These are the more superficial ones. And when we're looking at low back pain, we start to bring in concepts of kinetic chain relationships. What I mean by this is if we look at these superficial structures here, some of the larger muscles in the back here, latissimus dorsi, traps, different muscles, we start to see that as we go down here, we've got this white area in here. This is fascia or connective tissue. Well, what this basically shows us is that anything that goes on in the lower extremity, any force generated in this area, is also going to affect the low back, and we're going to get stress in different areas. So in other words, if we go down the legs and we look at the back of the legs, the muscles there called the hamstrings, and they're really tight, short, and contracted, we're going to see that this is going to change the position of our pelvis, cause a lot of tension in the low back. Consequently, we're going to start to get misalignments or restrictions. And the rest of our body is going to tighten up and get very constricted, and the person's going to experience a lot of low back pain. So just as we were talking about restrictions in the posterior of the body, we also have to consider what's going on in the front. It's sort of like my bicep here. If I'm going to contract my bicep, my tricep has to relax. If I've got a lot of tension in my back, everything at the front is going to work a lot harder. So if we're looking at what we call biokinetic relationships or the kinetic chain, we're going to see that anytime something tightens up at the back, everything at the front, in terms of our abdominal muscles, deep muscles to that, our hip flexors, are going to get very, very short and contracted. So when a practitioner gets in and they start working on an area or looking for restrictions, they don't want to just go in the area of symptoms. They want to consider what we consider antagonistic relationships. In other words, one muscle gets short and contracted, always look at the opposing structure. This is where a lot of practitioners really don't resolve problems because they only go to the point where the pain is. You have to consider these relationships. Extremely important.
So what do we do to treat low back problems? We'll begin by looking at the actual soft tissue structures. We'll look at the muscles, the ligaments, the tendons, and the nerves that pass through those areas. And we'll find out where the patient is tight and restricted. We'll use our hands and we'll try to feel ropiness, tenderness, sensations like BBs underneath our hands. Once we find those tight, restricted areas, we use treatment methods such as active release technique, Roston, massage therapy to break up the scar tissue that is formed in that area. So once we've found the adhesions and we've freed them up, we'll send our patients home with rehabilitation exercises. Oftentimes that consists of stretches. There'll be static stretches for the core area and upper leg areas such as the thighs or the quadriceps, hamstrings, glute muscles. And then we'll often use a foam roller and we'll free up some of the areas in the spine and upper leg area. And then on top of that, we'll give strengthening exercises. That's to strengthen the core, build balance, and be more aware of your posture in space, or proprioception.